30th. Namaskar, good morning, and welcome to the 11th episode of the hour-long online series brought to you by IHL Wellness in association with New Delhi-based HEAL Foundation. I am Shankar Raj, President of HEAL Foundation, and we are live on Facebook and YouTube. I'll be moderating this episode with my co-moderator, Kishore Malviya. In today's episode, there will be two sessions, one on breast cancer prevention, causes, symptoms, signs, stages, and types, and second on obesity, when and how to start a weightless program journey. October marks the Breast Cancer Awareness Month. October 21 is observed as Pink Day to create awareness on the need to fund breast cancer support groups. Substantial progress on breast cancer awareness and research funding has helped create advances in the diagnosis and treatment of breast cancer. Breast cancer survival rates have increased, and the number of deaths associated with the disease is steadily declining, largely due to factors such as early detection, a new personalized approach to treatment, and a better understanding of the disease. According to reports, breast cancer has been ranked number one cancer among the Indian females, and age-adjusted rate as high as 25.8 per 1 lakh women, and mortality of 12.7 per 1 lakh. Another report said in India, every 4 minutes, a woman is diagnosed with breast cancer, and one woman dies in every 13 minutes. To speak more on this, we have with us Dr. Ishu Gupta, a senior consultant medical oncology at Fortis Hospital, Noida, and Dr. Shubhi Yadav, a consultant oncologist at Dharamsila Narayana Super Speciality Hospital, New Delhi. Now, Kishore, you can start for your first round of questions.
Thank you, sir. Welcome, Dr. Ishu Gupta and Dr. Shubhi Yadav, and namaskar.
No, thank you. Namaste.
फर्स्ट राउंड आज हम हिंदी में शुरू करते हैं, हमारा हिंदी के में राउंड. डॉक्टर इशू गुप्ता
जी सर,
ब्रेस्ट कैंसर के मामले में भारत दुनिया में कहाँ खड़ा है? क्या इंडियन विमेन ज्यादा वल्नरेबल है दूसरे देशों की अपेक्षा?
सर अगर हम डेटा की बात करें तो ब्रेस्ट कैंसर इंडिया में हालांकि बढ़ रहा है. अभी जैसे कि सर ने बताया कि 1 लाख में से अराउंड 25 से 26 वुमेन जो इंडिया में हैं, दे सफर फ्रॉम ब्रेस्ट कैंसर. इसी चीज को जब हम वेस्टर्न डेटा से कंपेयर करते हैं तो वेस्टर्न डेटा में in 1 lakh about 100 or 120 women also suffer from breast cancer. तो हालांकि इंडिया में अभी we won't say कि उतना ज्यादा कॉमन है जितना वेस्ट में है, लेकिन उसका इंसिडेंस डेफिनेटली बढ़ रहा है. एंड द अदर थिंग इज इंडिया में उन्होंने ऑलरेडी अभी बताया भी कि इंडिया में मोस्ट कॉमन ब्रेस्ट कैंसर जो है फीमेल्स में इज ब्रेस्ट कैंसर. सो ऑलमोस्ट टोटल फीमेल कैंसर्स के लिए 30% ऑफ द कैंसर्स इज ब्रेस्ट कैंसर. Another important fact जो कि इंडिया के लिए मैं स्पेसिफिकली कहना चाहूंगा that we are seeing a lot more younger population जो ladies less than 50 years of age में developing breast cancer. So we can easily say that as per data that 35 to 40% of newly diagnosed breast cancer ladies are less than 50 years of age in India. ये थोड़ा यूनिक है इंडिया के लिए compared to the West.
डॉक्टर साहब, ज्यादातर मामलों में देखा गया है कि पेशेंट को बहुत देर से पता चलता है कि उनको ब्रेस्ट कैंसर है.
हाँ जी.
क्या कोई शुरुआती लक्षण नहीं है जिसके आधार पे उन्हें ये लगे कि ये हो सकता है, जांच कराई जाए?
तो जी इस चीज के कई कारण हैं एक्चुअली, लेकिन सबसे इम्पोर्टेंट कारण जो मैं कहूँगा वो होते हैं, दो कारण होते हैं। एक तो लैक ऑफ अवेयरनेस, पेशेंट्स को खुद को नहीं पता, जो रूटीन फिजिशियंस होते हैं, जो रूटीन फिजिकल चेक्स नहीं होते, और अगर होते भी है तो ब्रेस्ट एग्जामिनेशन उसका एक रूटीन पार्ट नहीं होता। कोई स्क्रीनिंग मोडालिटीज ज्यादा इंडिया में यूज नहीं होती। दूसरा, ब्रेस्ट कैंसर में टिपिकली अर्ली स्टेजेस में पेन नहीं होता, तो जब तक पेशेंट को पेन नहीं होता तो पेशेंट ना डॉक्टर की हेल्प के लिए सीख नहीं करता। तो अर्ली साइंस एंड सिम्टम्स के लिए स्पेसिफिकली इंडिया में we will have to spread this awareness to the patients, people and even general physicians कि routine physical breast exams, या वो सेल्फ हो या फिर क्लिनिकल हो, by the doctor, self by the patient themselves, should be done routinely. इस चीज को जितना हम स्प्रेड कर पाएंगे probably we will be able to catch them early. Also स्क्रीनिंग टेस्ट जो मोडालिटीज हमारी हैं उसके बारे में अवेयरनेस फैलाने से, मैमोग्राफी जो ईयरली होनी चाहिए 40 to 45 इयर्स के बाद, इट कैन हेल्प अस।
नहीं डॉक्टर साहब, मेरा ये कहना था कि मान लीजिए किसी को कोई कुछ नहीं है, एकदम बिल्कुल स्वस्थ है,
हाँ जी,
और वो चेक कराने जाए और पता चला कि ब्रेस्ट कैंसर है। मेरे कहने का मतलब है कि शुरुआती लक्षण कुछ तो होगा जिससे कि उनको आभास हो, कोई गांठ पड़ जाना या कुछ और हो जाना।
तो जी शुरुआती लक्षण अगर खुद से या तो वो ब्रेस्ट एग्जाम करें, या फिर जो डॉक्टर ब्रेस्ट एग्जाम करता है और उनको कोई छोटी गांठ मिलती है, या फिर जो ब्रेस्ट का साइज में डिफरेंस उनको नोटिस होता है। ब्रेस्ट पेन यूजुअली कॉमन सिम्टम नहीं है, डिस्चार्ज होना इज ऑल्सो पॉसिबल, स्किन में थिकनिंग आना या फिर बगलों में थोड़ा गांठ का महसूस होना, ये सारे सिम्टम्स कहीं ना कहीं ब्रेस्ट कैंसर की तरफ इशारा कर सकते हैं। पेशेंट को चेक कराना चाहिए।
मैंने डॉक्टर साहब कहीं पढ़ा था कि ब्रेस्ट कैंसर के बारे में एक मिथ है कि ये सिर्फ महिलाओं को होता है, पुरुषों को भी होता है।
जी बिल्कुल।
तो इंडिया में क्या स्थिति है पुरुषों के मामले में?
इतना कॉमन नहीं है पुरुषों में, लेकिन टोटल ब्रेस्ट कैंसर्स का लगभग 1%, 1 in 100 कैन बी अ मेल।
डॉक्टर साहब, मैं ये भी पढ़ रहा था कि सिलिकॉन ब्रेस्ट इम्प्लांट्स जो होते हैं वो ब्रेस्ट कैंसर के रिस्क को बढ़ाता है, क्या ये सच है?
ये ट्रूली सच है। वी कैन से कि ये मिथ भी नहीं है, सच भी नहीं है। ये जरूर है कि अगर सिलिकॉन इम्प्लांट्स हैं तो अर्ली ब्रेस्ट कैंसर डिटेक्ट करना कभी कभी मुश्किल हो जाता है, बट पर से वो रिस्क को बढ़ाता है ऐसा नहीं है।
भारत के संदर्भ में सबसे ज्यादा कॉमन कारण क्या है ब्रेस्ट कैंसर, जो सबसे ज्यादा कॉमन है?
भारत के संदर्भ में सबसे ज्यादा कॉमन ब्रेस्ट कैंसर के कारण सबसे पहले तो एज ही होता है। जैसे कि जितनी ज्यादा पेशेंट की एज होती है उतना ज्यादा ब्रेस्ट कैंसर कॉमन होता है। तो 50 इयर्स में जितना कॉमन है उससे ज्यादा कॉमन है 60 इयर्स की एज में। दूसरा, जेनेटिक्स जो होते हैं, जेनेटिक्स इंडियन पॉपुलेशन में अभी इतना डेटा नहीं है इस चीज के ऊपर कहने के लिए, लेकिन लगभग 10% ब्रेस्ट कैंसर्स जेनेटिक्स से रिलेटेड हो सकते हैं। इसके अलावा पहले कोई रेडिएशन एक्सपोजर हुआ है, ओबेसिटी है, जैसे जैसे पेशेंट के वेट बढ़ते हैं वैसे वैसे देखा गया है कि ईस्ट्रोजन प्रोडक्शन बॉडी में बढ़ती है, जिसकी वजह से ब्रेस्ट कैंसर का रिस्क बढ़ जाता है। अल्कोहल फीमेल्स में इज ऑल्सो अ रिस्क फॉर डेवलपिंग ब्रेस्ट कैंसर्स। इसके अलावा टाइमिंग ऑफ प्रेगनेंसी, जो फीमेल्स के रूटीन मेंस्ट्रुअल साइकिल्स होते हैं उसका स्टार्ट जितना जल्दी होता है और उसका एंड जितना लेट होता है, ये सारी चीजें कंट्रीब्यूट करती हैं कहीं ना कहीं ब्रेस्ट कैंसर के लिए।
थैंक यू डॉक्टर साहब, आप हमारे साथ बने रहिए।
Sure.
हम अभी सेकंड राउंड में मिस्टर शंकर आपके पास आएंगे।
हाँ जी।
डॉक्टर शुभी यादव
जी,
मैं कहीं पढ़ रहा था कि ब्रेस्ट कैंसर सर्वाइवर को रिकंस्ट्रक्शन सर्जरी करानी चाहिए, ये क्या है और कितना जरूरी है?
ब्रेस्ट कैंसर सर्वाइवर की बात नहीं करेंगे हम खाली यहाँ पर। जब भी हमारा मोडालिटी देखते हैं हम ब्रेस्ट कैंसर की सर्जरीज की, सो इन दैट केस हमारे पास पहले एक ऑप्शन होता था कि टोटल ब्रेस्ट रिमूवल, यानी कि सारा का सारा ब्रेस्ट हमने निकाल दिया। बट दिस इज समथिंग दैट इज रिलेटेड टू द वुमेनहुड। साइकोलॉजिकली एक वुमेन के लिए बहुत डिस्ट्रेसिंग होता है, क्योंकि उसकी कहीं ना कहीं इमेज को लेकर होता है। सो नो डाउट वी हैव न्यू मोडालिटीज ऑल्सो जिससे हम ब्रेस्ट को कंजर्व कर सकते हैं। बट अगर ऐसी स्थिति है, आपके ट्यूमर का साइज ऐसा है कि हमें सारा का सारा ब्रेस्ट निकालना पड़ता है, सो इन दैट केस हम पेशेंट्स को रिकंस्ट्रक्शन का ऑप्शन देते हैं. सो व्हाट एग्जैक्टली इज रिकंस्ट्रक्शन? इट डिपेंड्स अपॉन कि आप कितना साइज निकाल रहे हो ट्यूमर का. कई बार ट्यूमर का साइज छोटा है पर वो वहीं पे थोड़ा फैला हुआ है, सो इन दैट केस हमें एक थोड़ा सा लार्जर एरिया ब्रेस्ट का वहां से निकालना पड़ता है. तो हम पेशेंट के अपने ही ब्रेस्ट के जो फैट सेल्स होते हैं उनको वहां पर लेकर आकर नया ब्रेस्ट बना देते हैं. दिस इज वी कॉल्ड एज ऑन्कोप्लास्टिक रिकंस्ट्रक्शन. कई बार स्थिति ऐसी होती है कि ट्यूमर का साइज इतना ज्यादा बड़ा है कि हमें टोटल ब्रेस्ट निकालनी पड़ती है. सो इन दैट केस या तो हम पीठ से मसल लेकर या पेट से फैट को लेकर हम आपका नया ब्रेस्ट रिकंस्ट्रक्ट करके देते हैं. और कई बार अगर ऐसी स्थिति नहीं हो पाती कि हम वो भी पॉसिबल नहीं है पेशेंट में बिकॉज ऑफ सर्टेन रीजन या पेशेंट नहीं चाहता, तो हम सिलिकॉन इम्प्लांट्स भी दे सकते हैं. सो व्हेनेवर इट कम्स, बिकॉज दिस इज समथिंग रिलेटेड टू द फीमेल, उनकी वुमेनहुड को इफेक्ट करता है, साइकोलॉजिकली बहुत डिस्ट्रेसिंग होता है. तो जब भी पेशेंट हमारे पास आती है, वी ऑलवेज गिव देम द ऑप्शन ऑफ रिकंस्ट्रक्शन. एंड सेकेंडली, बिकॉज यू आस्क्ड दिस क्वेश्चन एंड दिस वाज वेरी वैलिड, अगर कहीं पे भी पेशेंट जाएं और उनको ऑप्शन मिलता है कि नहीं हम जा सकते हैं, तो वो अपने डॉक्टर से हमेशा पूछें कि रिकंस्ट्रक्शन का ऑप्शन क्या है. सो रिकंस्ट्रक्शन इज बेसिकली आपका फ्लैट चेस्ट नहीं होगा, नॉर्मल ब्रेस्ट जैसे आपका था वैसा का वैसा ब्रेस्ट आपको रिकंस्ट्रक्ट करके देते हैं. मे बी नॉट टोटली सिमिलर बट नो डाउट इट इज क्वाइट हेल्पफुल फॉर द पेशेंट्स.
डॉक्टर शुभी
जी,
क्या ब्रेस्ट कैंसर को प्रिवेंट किया जा सकता है, और अगर किया जा सकता है तो वो प्रिवेंटिव मेजर्स किस उम्र में शुरू होना चाहिए, किस उम्र में करना चाहिए?
जैसा अभी बताया, हम लोगों ने बात की ब्रेस्ट कैंसर के कॉजेस के बारे में. तो कुछ चीजें हैं जो हमारे हाथ में हैं, कुछ चीजें हैं जो हमारे हाथ में नहीं है. जैसे अगर मैं जेनेटिक्स की बात करूं तो दैट इज समथिंग वो हमारे हाथ में नहीं है. बट देयर आर सर्टेन थिंग्स जो हमारे हाथ में, हैविंग अ हेल्दी लाइफस्टाइल, प्रॉपरली एक्सरसाइजिंग, unnecessarily without prescription हार्मोन इनटेक ना लेना. सो दैट थिंग्स वी कैन डू. सो ये चीजें कंट्रीब्यूट करती है प्रिवेंट करने के लिए. दूसरा जो बात उठती है वो होती है स्क्रीनिंग की. तो स्क्रीनिंग में सबसे पहले आता है कि हम अपनी पॉपुलेशन को ना 2 ग्रुप्स में डिवाइड करते हैं. एक पॉपुलेशन है जो एवरेज रिस्क पे, एक पॉपुलेशन है जिसमें हाई रिस्क है. तो सारे लोगों को हम एक ही मापतोल में नहीं रख के स्क्रीन कर सकते. सो जनरली इसकी मोडालिटीज जो स्क्रीन करने की है, जैसे पहले बात हुई अभी, कि हम ब्रेस्ट को सेल्फ एग्जामिन करें. एक वुमेन के खुद के हाथ में ये पावर है कि वो अपने डिजीज को बहुत जल्दी पकड़ ले. दूसरा होता है कि हम डॉक्टर से एग्जामिन करवाएं, और तीसरा होता है कि हम इमेजिंग यानी कि टेस्ट की मदद लें. अब किस टेस्ट को कब करना है, दैट इज वेरी इंपॉर्टेंट. सो अगर एवरेज रिस्क है, मतलब ज्यादा रिस्क नहीं है, तो सेल्फ ब्रेस्ट एग्जामिनेशन जैसे ही ब्रेस्ट किसी भी महिला के फुली फॉर्म्ड होते हैं एट ए यंगर एज ग्रुप लाइक 17 to 18 ईयर्स, हम तब से शुरू करते हैं. एंड बिकॉज दिस इज अ वेरी गुड प्लेटफॉर्म राइट नाउ, एंड हमारा ब्रेस्ट कैंसर अवेयरनेस मंथ ही होता है अक्टूबर, आई टेक दिस अपॉर्चुनिटी कि मैं बताऊं कि सेल्फ एग्जामिनेशन कैसे करना है. सो इन दैट केस आपको कुछ नहीं करना, मिरर में खड़े होना है आपके पीरियड्स के बाद में, और दोनों ब्रेस्ट की शेप को देखना है. आपको कोई चेंज महसूस हो रहा है, आपको स्किन में कोई चेंज लग रहा है, आपको लग रहा है आपकी ब्रेस्ट का एक साइज का साइज बढ़ रहा है, और जेंटली विद द पाम ऑफ द हैंड्स दिस थिंग इनटू अ सर्कुलर मोशन, धीरे धीरे घुमाते हुए बाहर से अंदर की तरफ आते हुए आप अपने ब्रेस्ट को महसूस करें. आपको इसमें कोई गांठ तो नहीं महसूस हो रही. सो ये आप हर महीने करें पीरियड्स के बाद में, और जिन महिलाओं को पीरियड्स बंद हो गए हैं वो कोई भी एक दिन फिक्स कर सकते हैं. सेकेंड है आप डॉक्टर को दिखाएं. आमतौर पर अप टू 40 ईयर्स ऑफ एज ये इतना कॉमन नहीं है, 2 इंसिडेंट्स अब बढ़ रहा है. जैसे अभी बात हुई कि इंडियन पॉपुलेशन में स्पेशली 15 to 20% लेस देन 40 पे भी हो रहा है. तो आप 3 साल में एक बार अपने डॉक्टर को दिखा सकते हैं. नॉर्मली इस टाइम पे इमेजिंग यानी कि जिसे हम बोलते हैं अल्ट्रासाउंड कराना ब्रेस्ट का या मैमोग्राफी कराने की जरूरत नहीं है. 40 साल के बाद में क्योंकि इसका इंसिडेंस बढ़ता है, तो वी रिकमेंड कि आप एटलीस्ट साल में एक बार मैमोग्राफी और एक बार अपने डॉक्टर से अपनी जांच जरूर कराएं. सेकेंड आता है हाई रिस्क पॉपुलेशन. हाई रिस्क पॉपुलेशन मतलब वो लोग जिनमें कैंसर होने के चांसेस ज्यादा हैं. तो जो रिस्क फैक्टर्स हैं वो तो है ही हैं, साथ में अगर आपकी फैमिली हिस्ट्री है, सपोज आपकी मदर को या आपकी सिस्टर को कैंसर है, जो कि हम फर्स्ट डिग्री रिलेटिव बोलते हैं. सेकेंडली, अगर आपकी किसी कजन को, बुआ को, मासी को कैंसर है, जो कि सेकेंड डिग्री रिलेटिव है, तो आप में कैंसर होने का चांस ज्यादा है. सेकेंड, अगर आप में कोई जेनेटिक अबनॉर्मलिटी आ रही है, यानी आपकी जीन्स में प्रॉब्लम आ रही है, जो कि आजकल हम पेपर्स वगैरह में पढ़ते रहते हैं, काफ़ी आता है ब्रैका जीन टेस्टिंग के बारे में. सो अगर वो है तो इन दैट केस आपको ज़्यादा फ्रीक्वेंट एंड ज़्यादा कॉन्शियस होना पड़ेगा. दीज आर द पेशेंट्स जिनमें स्क्रीनिंग हम आमतौर से 30 से 35 साल पे शुरू करते हैं. सो हम या तो अल्ट्रासाउंड ब्रेस्ट कराते हैं, पेट का अल्ट्रासाउंड कराते हैं और 40 साल के बाद में मैमोग्राफी कराते हैं. बट अगर आपकी मदर को या सिस्टर को सपोज करिए कैंसर 40 साल से या 45 साल की उम्र में हुआ है, सो इन दैट केस हम उससे 10 साल पहले स्क्रीनिंग शुरू करते हैं सो दैट हम कैंसर को जल्दी पकड़ पाए. और आई थिंक हाई रिस्क की अगर हम बात करें तो इन दैट केस एंजेलिना जोली ने बहुत बड़ा एग्जांपल दिया है टू अस. उनकी मदर को कैंसर था एंड शी टेस्टेड टू बी ब्रेका पॉजिटिव. सो उन्होंने अपना बाद में ब्रेस्ट का सर्जरी कराया एंड उसके बाद में एक बार उनकी फैमिली कंप्लीट हुई तो उन्होंने अपने बाकी प्रोसीजर्स भी कराए. सो दिस इज हाउ द अवेयरनेस शुड गो एंड स्क्रीनिंग शुड बी डन.
जैसा कि डॉक्टर ईशू गुप्ता ने अभी बताया कि 10% मामले ही होंगे जो जेनेटिक होंगे, यानी 90% केसेस ऐसे हैं जैसा कि आपने बताया कि वो प्रिवेंटिव हो सकते हैं. तो वो 90% जो केसेस हैं उनमें सबसे ज्यादा कॉमन क्या है इंडिया में?
मैं क्या मतलब ब्रेस्ट कैंसर के टाइप के
कारण में
कारण एज सच मोस्ट इम्पॉर्टेंट कारण तो ऐसे हम पॉइंट आउट नहीं कर पाएंगे, बट डेफिनेटली अगर आपकी स्ट्रॉन्ग फैमिली हिस्ट्री है वो काफी बड़ा कारण रहता है. और सेकेंडली अनहेल्दी लाइफस्टाइल कहीं ना कहीं बहुत ज्यादा कंट्रीब्यूट कर रहा है इसको. एंड हार्मोनल इनटेक, पेशेंट्स ओवर द काउंटर गूगल से पढ़ के रिव्यूज लेकर हार्मोन थेरेपी लेना शुरू कर देते हैं. कितने समय तक लेना है, कैसे लेना है, इसका उन्हें ज्ञान नहीं होता. सो दे टेक इट फॉर अ लॉन्गर पीरियड ऑफ टाइम. अगर हम ब्रेस्ट कैंसर की बात करें तो ईस्ट्रोजन हार्मोन इसमें कहीं ना कहीं एक मेजर रोल प्ले करता है. सो आई थिंक हार्मोनल इनटेक शुड बी लिमिटेड और कहीं ना कहीं एक्सरसाइज वगैरह करके एक हेल्दी लाइफस्टाइल. ओबेसिटी बहुत बड़ा कारण है क्योंकि अगर ओबेस होते हैं आप तो एडिपोज टिश्यू ज्यादा होता है आपकी बॉडी में, उसमें ईस्ट्रोजन हार्मोन ज्यादा प्रोड्यूस होता है, तो देयर आर मोर चांसेस ऑफ डेवलपमेंट ऑफ कैंसर.
डॉक्टर शुभी
जी,
जैसे कि अभी आपने कारण बताया, मैं ये जानना चाह रहा था कि इसके टाइप्स और स्टेजेस क्या होते हैं?
ब्रेस्ट कैंसर मुख्य तरह से दो तरीके का होता है. एक डक्टल कैंसर हम इसको बोलते हैं और एक लोबुलर टाइप का कैंसर होता है. स्टेज की अगर हम बात करें तो सबसे पहले हमें समझना होगा कि व्हाट एग्जैक्टली इज कैंसर. तो कैंसर इज समवेयर वेयर वी हैव एन abnormal growth of cells. So until and unless when it arises from the breast tissue, that is breast cancer. So जब तक वो हमारे ब्रेस्ट टिश्यू को सीमित है और एक्सिलरी एरिया मतलब आर्मपिट को लिमिटेड है, उसको हम कैटेगराइज करते हैं स्टेज 1 to 3. वहां पे हम उसको डिफरेंशिएट करते हैं कि उसका साइज कितना है, उस पर डिवाइड किया जाता है कि वो स्टेज 1 है, स्टेज 2 है या स्टेज 3. जब वो वहां से उठ के चेस्ट वॉल को चला जाए, मसल में चला जाए, लंग को जाए, लिवर को जाए या बोन को चला जाए, तो हम उसे स्टेज 4 कैंसर कहते हैं. सो दिस इज हाउ द कैंसर इज बीइंग स्टेज्ड. तो नॉर्मली अगर हम देखें तो स्टेज 1 to 3 का ट्रीटमेंट इज क्वाइट गुड, रिस्पॉन्स टू द ट्रीटमेंट इज क्वाइट गुड. बट अगर स्टेज 4 की हम बात करें तो वहां पे हमें पैलिएटिव कीमोथेरेपी ही देनी पड़ जाती है पेशेंट्स को. द रिस्पॉन्स इज एक्चुअली नॉट दैट गुड एज वुड हैव बीन विद द अर्लियर स्टेज.
मेरा आखिरी सवाल
जी,
क्या ये मिथ है या इसमें सच्चाई है कि एक खास तरह की ब्रा भी रिस्क बढ़ाता है, खास करके जो अंडर वायर ब्रा है?
जी, आपने ये बहुत वैलिड क्वेश्चन पूछा क्योंकि मेरे पास ओपीडी में कई बार पेशेंट्स आते हैं एंड दे हैव दिस क्वेश्चन. किसी भी तरीके की ब्रा, चाहे वो अंडर वायर्ड है, एंड इवन कई लोग का मिथ है कि इवन कलर भी मैटर करता है, वो मैटर नहीं करता. ऑल यू नीड टू डू इज wear a comfortable and a proper size bra. So that is what is matters. It is not related to the underwide bra or anything else. ये बहुत बड़ा myth है and it should be taken care. Secondly, कई लोग का इसमें आपने पूछा ये myth से related, लोग कहते हैं डिओड्रेंट लगाने से कैंसर हो जाता है. ऐसा नहीं है. But no doubt कॉस्मेटिक्स के लिए जो हम बहुत सारे प्रोडक्ट्स यूज करते हैं, so that may harm our body. So उसके लिए I'll just advise कि आप नेचुरल प्रोडक्ट्स की तरफ जाएं, नेचुरल प्रोडक्ट्स यूज करें. So that will be good for you.
ये भी कहा जाता है कि आर्म पिट में रेजर चलाने से या ब्लैक कलर का ब्रा पहनने से ये सबसे
जी इसी पॉइंट मैंने बोला कि ब्लैक कलर की ब्रा पहनने से, अंडरवायर्ड ब्रा पहनने से कुछ नहीं होता. ऑल यू नीड टू डू इज बहुत टाइट फिटिंग ब्रा ना पहने, आपकी साइज की फिटिंग की ब्रा आपको पहननी चाहिए.
थैंक यू डॉक्टर शुभी यादव. ओवर टू यू मिस्टर शंकर.
Thank you, Kishore. Dr. Ishu, I'll come to your question. One question is that how dangerous is breast cancer compared to other forms of cancer like lung cancer, throat cancer, etc.?
So, sir, thank you for the question. Basically, breast cancer, Dr. Shubhi just mentioned, is divided into stages 1, 2, 3, 4. So, the survival rates actually vary across the stages, right from a 5-year survivals ranging from 99% almost in stage 1 to less than 30% in stage 4. So, how good the outcomes would be, they depend on one, the stage. Also, another very important factor here is the type of breast cancer. For all clinical purposes, breast cancers are divided into a few categories. That is a hormone positive category, there is a HER2 positive category, and there is a triple negative category. So, all these are devised after some special tests are done on the biopsies. And one category, that is the hormone positive category, is tend to do much better. So even stage 4 hormone positive breast cancers are these days, with the advances in medicine, doing more than about 3.5 to 4 years. But unfortunately, there is another category, that is a triple negative category, in which a stage 4 cancer might just give us around a year and a half. So that depends on the stage, that depends on the type, and that depends on where you are taking the treatment also. So the breast cancer mortality rates in India are much higher than they are in the West. They're probably around 3.5, 4 times higher than the West, probably because of one, the patients are more diagnosed in the advanced stages, and the other reason might be some the healthcare facilities not being that good or that widespread to each and every part of the country.
Among the types of breast cancer that you just mentioned, is there a type of breast cancer that really spreads very fast? I'm asking this question because when Glenn McCart's wife, Jane McCart, died, the cancer spread pretty fast. He was also not expecting. He was on a tour, and his wife was back in Australia. So, is there a cancer that spreads pretty fast than the other types of cancer?
Correct. So, sir, basically on the genetic level, the breast cancer is then divided into 4 categories further, 4 or even 5. Luminal types, luminal A and B, HER2 enriched, then basal. So, of all these genetic types of breast cancer, the basal type of breast cancer is said to spread much faster than the others, and is tend to involve the other organs of your body like liver and brain much faster than the other types of breast cancer.
This cancer also spreads to the bone pretty fast?
Bones, yes. Bones also. The most common organs that the breast cancer spreads to is lung, is liver, is bone, and is the brain.
Brain, okay. Now, recently, the Tata Memorial Center presented a study, quite an interesting study, that said that the use of a local anesthesia, which costs just rupees 30, just before surgery, can drastically improve the cure and survival rate of breast cancer patients. Can you elaborate on this?
Right. So there was this study on use of a local anesthetic, that is a lignocaine, which is actually widely used in the clinic, in the surgeries, in day-to-day practice, not even in major surgeries, even in minor surgeries for local anesthesias. The study did show that there was a significant survival benefit, significant outcome benefit to the patients who were getting lignocaine versus not getting the ones. But what was the exact cause? And the study needs to actually be done on a larger scale to demonstrate this benefit truly. Theoretically, how this would happen is yet not deciphered.
I think Tata Memorial is doing it across all their hospitals to widen the study.
Correct. It's not a study, and a larger study, if it confirms, it would be very good, and it would be a very cheap modality of treatment that would be able to improve the outcomes.
How effective are mammograms? Are there cases wherein mammograms are interpreted wrongly and women missed out on initial treatment options?
So yeah, very good question. Mammograms are very effective. Mammograms are very, very effective. They are one of the most important measures or modalities that can help us screen or diagnose breast cancer both. But there is a caveat to that, being younger ladies in the age of 25, 30, though the breast cancers are not very common there, or ladies who have a more dense breast, on the imaging. In those patients, the mammograms might tend to miss out a few small lesions. And the other caveat being, a mammography never confirms the diagnosis. So every time a lesion is picked up on the mammography, it should definitely be followed by a biopsy or at least an FNAC. So they don't overdiagnose, but yes, there is a tendency that a lesion would be picked up, any lesion that there is a risk of breast cancer more than 2% that is on the mammography, we would try and biopsy that. And biopsying those lesions might be discomforting for about a few patients because they might not be diagnosed with breast cancer eventually. There is a fear factor that would come in initially that, oh, my mammogram is showing something abnormal, I might have breast cancer. The biopsy report will take another week. So the 1 week the lady goes through would be something, just imagine, I might have cancer, I might not have cancer. So all of that, yes, it does increase those factors, but definitely if we talk of saving lives, it saves lives.
In one of our earlier IHL shows, we had a researcher from Bengaluru who demonstrated that artificial intelligence is fast replacing the conventional mammogram.
Correct.
It is easy to use and more accurate. So what do you think is the future of AI, artificial intelligence, in breast cancer detection?
Again, a very good and a futuristic question. So we have something called as digital tomosynthesis. The mammogram basically gives us a 2D image of the breast. The digital tomosynthesis is almost a CT-based imaging of the breast rather than an X-ray based imaging, which is the mammogram. And along with artificial intelligence, the digital tomosynthesis is able to provide us much detailed, better, and a sensitive modality that can detect breast cancers or lesions otherwise. So definitely it has been spreading in the West, spreading in the developed countries, and should, yes, come to us in the commercial aspect also, though on the research aspects and in certain hospitals, there are people doing it, but it hasn't become very commercial and definitely would help patients.
Speaking of artificial intelligence, now we know that BRCA1 and BRCA2 genes are reportedly involved in breast cancer. With artificial intelligence making inroads in faster DNA sequencing, is it possible one day to edit out these genes?
To?
Edit out these genes.
Edit out the genes. I am really unsure of that. So BRCA1, BRCA2, they are very important genes per se. But the mutations in those genes is the problem. So when the genes are not functioning, you edit them out, but the function is lost. They have to be replaced by a normal gene. The gene therapy in breast would probably very investigational at this stage. I don't think people have tried it right now, but is a good thought.
Okay. Another question is that, I think there was a reference to Angelina Jolie in 2013, disclosed that in New York Times that she had undergone risk-reducing bilateral mastectomy, or RRBM, after learning that she was a BRCA1 mutation carrier, and her mother and also grandmother had this problem. This led to what is termed as the Angelina effect. Is risk-reducing bilateral mastectomy still an option?
So yes, Dr. Shubhi mentioned about two population risk groups, that the population should be divided into a high risk and a low risk population. This can be done by certain factors that when combined together can give us a score which can label you a low or a high risk. The factors might include the age, the family history, previous exposure to radiation, your obesity, and other factors. So if somebody is in the high risk, if somebody is detected with a breast cancer previously, if somebody has a known BRCA mutation, if somebody has a very strong family history, not just of breast cancer in the ladies, but also in fathers and brothers, prostate cancers, anybody having ovarian cancer, pancreatic cancer, all of them can be associated with BRCA, mutations. So in case there is that history, it is definitely an option that the patients go ahead with risk reduction mastectomies, bilateral, and also sometimes a bilateral risk reduction oophorectomy, that is removal of the ovaries also, as the mutations in BRCA not just increase the risk of breast cancer, but also the ovarian cancers.
Thank you. I'll just come back to you. Quite good inputs about futuristic, thoughts on breast cancer. Of course, the world of medicine is fast changing, and we do not know what's going to happen tomorrow, especially with genes. I'll come to you, Dr. Shubhi. Thank you. I'll come back to you, Dr. Shubhi.
Yes, please.
Now, self-examination is, you spoke about self-examination of breast, but self-examination is not being followed in several women aged about 20 who end up seeking help at third or fourth stage of the disease.
Right.
They're often shy to talk even as they notice changes. How can this be overcome?
This is how we are overcoming. We are trying to overcome, creating the general awareness. So I think that is all what we can do. Because see, we need to address this population, and we need to tell them that, their hands have the greatest power to pick up the disease at an early age. So that is all we can do for this. Because self-breast examination, many number of the cases can be picked up at an early stage. And the treatment modalities can be actually easier. So one thing that we need to address, and this message should go to them, is having a breast cancer is not a death sentence. So you can even have a normal life after that. But the thing is that your treatment, your further treatments onto it, so how aggressive we need to go depends upon the stage. So as early it is picked up, this message should go that we'll be able to prevent it.
You did describe rather in Hindi about how this is being done. Can you describe to our English audience as to how self-examination is done?
Okay, for self-examination, first of all, the women has to do, if you haven't attained your menopause, you should do it after your periods, once your periods are over, because during periods, there are certain hormonal changes that happen. So you may not be able to find out any lesion if it is that present. So you need to stand right in front of the mirror. Just put both your hands on your abdomen like this. Just look into the mirror. Look at the size and the shape of your breast. Notice whether you find any change into the shape, or you find that size of one side of your breast is larger than the other. Take your hands up right into the air and just see that with the movement, do you find any retraction? Your nipple is going inside, or you see that your skin, you see any amount of dimpling, or you see that your skin is thickened. With thickened, I mean at times it is so thickened that it gives you a feel of an orange peel that we call as beauty orange kind of an appearance. So in case if you notice anything, just go and seek your doctor. Secondly, with the palm of your hands, this is the most sensitive part, with a circular motion into the standing position, just from outside to inside, just come and examine in case if you feel any abnormality, any nodularity, or any growth. And then gently press your nipples to see in case if you find any discharge. So this can be done monthly after your periods. And once your periods have stopped, just fix up one day into month and just examine it, because this is more common into elderly age women. So I typically recommend them that they should do it.
You did answer a question about breast conserving surgery or lumpectomy. Now, how is it? Can you throw more light on this? What exactly is done and how it is done? Who are the women who are selected for this?
See, when it comes to the treatment of breast cancer, so we always think, and first question that everyone asks, what is the stage? So it's not only the stage actually that matters. It's also the nature of the tumor that matters. How aggressive it is, whether it is hormonal sensitive tumor or not, and what is the proliferation index of the tumor. So in case at times there are era where we cannot conserve your breast, either the growth is so high that we are not able to conserve your breast. But there is another population who is very young, so we cannot actually sacrifice your whole breast. So in that case, breast conserving surgery is done. So what exactly it is? We just take out the lesion, the unhealthy part of the breast, along with a good amount of margin that is adjoining that area. And after that, with your own fat cells, we try to reconstruct it. But whenever we go for breast conserving surgery, I would like to address over here that these are the patients who will require radiation no matter what is the stage of the disease, because we need to kill the cells which are not actually visible to the open eyes. So that is one option. Second option is, in case if you are not able to conserve your breast and the size of the lesion is actually big, in that case, we can give you an option for reconstruction. So reconstruction can be done using your own breast tissues, or we can take muscle fat from your back, we can take your abdominal fat, or we can even use the silicone gels, so that you have a normal appearance and these kind of dysmorphic features cannot be seen on it.
Now, is total removal of breast still an option? And what are the psychological issues that women face after that?
See, we talk about breast, I've already mentioned this is something related to the womanhood. So if I look at it psychologically, it is very distressing. The patients, they go under a lot of depression. And once you give them this option that their breast will be removed, their chest will be flat. So I think everyone can understand how depressing it is. So definitely we need to give them the option for reconstruction into these cases.
Now, apart from family history, lifestyle-related causes like obesity, tobacco, alcohol consumption, and lack of exercise, are all these contributory factors to breast cancer? Is it right?
Definitely a big toll. And that is what I said, that these are the factors which are somewhere into our own hands. So these are some things which we can actually modify. So whenever we talk about the risk into any cancer, we always talk about the modifiable risk factors and non-modifiable risk factors. So these are something that is modifiable. Adapting a healthy lifestyle can be modifiable. Doing exercise is modifiable. Taking a healthy life, again, is modifiable. Then not taking any unnecessary hormones, again, it's modifiable. Taking proper screening test, again, it comes to be a part of the modifiable things that you can prevent the disease early at an early stage.
It is said that those in their early 20s should also be more careful to watch for any subtle changes in their breasts than those who are in 30s, 40s. Is this true?
Not exactly, but yes, the incidence of breast cancer is rising, and we are seeing it into younger population also. If I talk about the Western world, younger population, I mean to say less than 40 or less than 35, only 6% of the women are affected. But unfortunately, if we look about the Indian stats, 15 to 20% of the younger population is affected by breast cancer. And that is why we should start the self-breast examination as soon as your breasts are formed. So starting at the age of 16, 17 years, we should start doing it. So that is how.
We always have this breast cancer awareness month and pink days and all, but is there a regular screening program for breast cancers?
See, all these programs are actually running as a part of it. So there is nothing to be called as which is actually absolutely dedicated. Why we have selected this month? So that we can talk more about it. We can spread more awareness about it. So that is why October is actually celebrated as a breast cancer awareness and also the ovarian cancer awareness month. So that is how we can do it.
But there is no dedicated screening program as such across India?
As such, this is not implemented into the government program, like this is how the screening should go. But screening guidelines definitely are there, which we have already spoken about, that how to screen a woman. So before the age, if you are less than 40 years of age, definitely every 3 years, at least once, visit your doctor, do your self-breast examination, and after the age of 40 years, at least get an annual mammography done for yourself. So this is how we can early pick up the disease.
Now,
so the whole idea is, I'll just interrupt, the whole idea is to pick up a disease at an early stage. So we are continuously talking about that the incidence of breast cancer has increased. But I would just mention, actually the mortality also from the breast cancer has decreased, because we are somehow, because of the awareness programs, picking up breast cancer at an early stage. That is what we call as DCIS, means they are in situ or into the stage of formation of the breast cancer. So we are picking up early lesions, early detection, early treatment, and a healthy lifestyle. So death rate definitely has come down.
Yeah. Dr. Shubhi, there are a lot of myths and doubts regarding breast cancer. Some people say breastfeeding might lead to breast cancer. Some people say not having breastfeeding might prevent breast cancer. People say that women who deliver can probably avoid breast cancer. All these, there are a lot of these myths regarding breast cancer. So what is the truth regarding it?
See, if I talk about the myths, there is actually a long list. So whenever a patient comes and walks in, so one thing is that definitely that comes first of all is a family history. Ki ghar mein to kisi ko nahi tha, fir mujhe kyun hua? So definitely that question has been addressed, that genetics play a role. Secondly, women who actually have their first child at a later age, so they are more prone to develop breast cancer. If you are not breastfeeding, maybe because of any reason, that is another issue that they can be a reason for development of breast cancer. If you have started your periods quite early, that we call as early menarche, or you haven't attained your menopause up to the menopausal age, so that is also one of the causes for breast cancer. So all these things are actually basically, if we see, are related to the hormones. So the longer the period, the exposure to the hormones is, so there are more chances of development of cancer. So whenever you are pregnant, so whenever you're breastfeeding, whenever you attain your menopause timely, so the ovarian function is actually stopped at that point of time. So that way the ovaries get rest, less amount of hormones are produced. So that time protection can be given.
I'll round up this session with one common question to both Dr. Ishu and you, starting with Dr. Ishu. What is, according to you, the most exciting research that is going on in the field of breast cancer?
So recently, this would be more technical that I would be saying right now. I don't know how many healthcare professionals are listening to this, but I just talked about 3 types of breast cancer: a hormone positive, a HER2 positive, and a triple negative breast cancer. In the last 3 to 5 years, the landscape of a HER2 positive breast cancer has changed altogether. The survivals, which were ranging in the range of 25 months, have now reached 58 months just by introduction of new drugs or sequencing of the older drugs in a proper fashion. So I think this is something that's really picking up. A targeted treatment, immunotherapies, all of these factors are actually picking up a lot and significantly contributing to the outcomes and also the quality of life of patients having metastatic breast cancer.
Good. Though it is technical, I would probably put it across the non-technical people as there is light at the end of the tunnel.
Yeah.
So, Dr. Shubhi, what is your viewpoint?
See, with the increasing rise, as addressed very clearly, we have a lot of hormonal receptors we are looking up to. We have a lot of proliferation index also that we are looking up to. So definitely with the newer modalities, and we are coming across where we can, first of all, being a surgeon, I'll just say, a lot of modalities and a lot of newer treatments we are looking onto where we can preserve your breast. Secondly, one thing that was not addressed into the surgical part also over here. Now, earlier, the total breast tissue removal was done along with in your axillary clearance, means all the nodes and all the tissue from your axilla, they were removed. So most of the patients used to have a lot of edema. Haathon mein सूजन आती थी उनके. So a lot of edema into their hands or shoulder pain, that was there. So with the newer modalities right now, we just pick up few glands from there. We test them. And if it is not required and we don't see any sign of cancer over there, so that thing is done. So that is also one new modality we are having. Again, reconstruction and all, again, form a part of it. And as well spoken by our medical oncologist, Dr. Ishu, we are having a lot number of targeted therapies right now these days. So we can actually conserve our patients going from mortality, basically, or morbidity, that in a healthy life.
Thank you very much, Dr. Ishu and Dr. Shubhi. Is wonderful. And apart from October, we really hope that breast cancer awareness will go throughout the year so that we can prevent mortality. And it is one of the forms of cancer that can easily be, caught very early, unlike other cancers. Thank you very much for being part of the session. Thank you.
Thank you. Thank you so much.
We now move on to session 2, which is on obesity, when and how to start a weight loss journey. Obesity is a lifestyle problem in slow motion, especially among youth and women. It is associated with various ailments like blood pressure, diabetes, heart ailments, etc. To speak more on this, we have Ms. Nazneen Hussain, a senior dietitian in Mumbai and runs Freedom, a beginning to a healthy you, a lifestyle management center that includes a holistic mind, body, soul approach in treating lifestyle ailments. Welcome, Ms. Nazneen. It is always wonderful having you on our show because with lucidity, you're able to describe what exactly to eat and what exactly not to eat. So I hand over this platform to Kishore to take this further.
Thank you, sir. Welcome, Nazneen ji. आप unmute कर लें.
Thank you, Kishore ji.
नाज़रीन जी, मेरा पहला सवाल ये है कि जब ओबेसिटी कम करने की बात हो रही है तो सबसे पहले लोग डाइट कम करने की बात करते हैं. एक सवाल बार बार पूछा जाता है कि जिनको ओबेसिटी थायराइड की वजह से है, क्या वो डाइट कंट्रोल से ठीक हो जाता है या उसके लिए कुछ और करना पड़ता है?
बहुत अच्छा सवाल पूछा किशोर जी. एक तो जब थायराइड जो हार्मोन है ये हमारा पूरा मेटाबॉलिज्म स्लो कर लेता है, तो ये एक नोन फैक्ट है। हावेवर जब पेशेंट्स जब एंडोक्राइनोलॉजिस्ट के पास जाते हैं और इनको थायराइड की दवाई दी जाती है, तो विद इन 3 months to 4 months ये लेवल्स जो है थायराइड के it starts becoming normal with the help of medicines. अब जो है this person who has gained weight has equal chances of losing weight like any other patient. हाँ, तो बहुत बार एक of course metabolism is slow because of thyroid, but after taking medicines patients need to understand कि फिर खुद की मेहनत है, then it is as equivalent to anybody who wants to lose weight. तो वो मेहनत हमको खुद से करनी है, तो डाइट है, एक्सरसाइज है, you can't only blame the thyroid because that has been taken care of with the medicine. So this is a very strong message I want to give.
दवा के साथ साथ एक्सरसाइज और डाइट प्लान भी ठीक होना चाहिए।
और हर वक्त खाली थायराइड का न ब्लेम करें, थोड़ा हमारे आहार में और लाइफस्टाइल पैटर्न में भी चेंजेस लाना जरूरी है। Not only diet and exercise, I think today the bigger problem is also sleep. Because लोग कम सोते हैं तो इनका जो जितने भी हमारे hormones है, जैसे ग्रेलिन हार्मोन जो हमारा हंगर इंक्रीज करता है, तो ऐसा माना गया है कि ये हार्मोन्स जो है रात को 12 AM to 4 AM के बीच में होते हैं। और आजकल नेटफ्लिक्स प्राइम का जमाना है, लोग सोते नहीं है, बहुत लेट सोते हैं, तो दे मिस द गैप, और बिकॉज दे डोंट स्लीप इनफ इनका हंगर पैटर्न जो है कंटिन्यूस होता रहता है, तो भूख जो है कम लगती है, और फीलिंग ऑफ फुलनेस जो लेप्टिन है, वाई पेप्टाइड है, जो हार्मोन्स है, ये इनमें कम हो जाता है, तो जितना इनको पूरा दिन भूख बहुत ज्यादा लगती है।
एक बात और कही जाती है ओबेसिटी के से जुड़े मामले में कि ब्लैक कॉफी या ग्रीन टी पीने से ओबेसिटी कम होती है, लेकिन बहुत से लोगों को मैं जानता हूं जो महीनों से ये करते हैं और बाकी प्रिकॉशंस भी रखते हैं, लेकिन वो कहते हैं कि 100 ग्राम भी मेरा कम नहीं हुआ।
So see, today जो obesity actually is called the emperor of all maladies, correct? और ग्रीन टी और जो ग्रीन कॉफी है, इनमें बहुत सारे कैटेचन्स है which help as fat burners, but that cannot be the only factor, correct? क्योंकि आज हमारे hormones है, हमारे genetics है, हमारा lifestyle है, ये सारा जो है इसका भी इंटरप्ले होता है। सो टुडे अगर एक बहुत अच्छा एक कनेडियन रिसर्चर है, इन्होंने बताया है कि ओबेसिटी जो है इट्स बिकॉज ऑफ 40 डिफरेंट रीजंस। इट मे बी मेंटल, इट मे बी फिजिकल, इट मे बी जेनेटिक, इट मे बी हार्मोनल। तो इन्होंने 40 डिफरेंट वेज ही हैज सेड व्हाई अ पर्सन कैन गेन वेट। तो ये जो हमारा एक थॉट प्रोसेस था कि a particular person is eating too much weight and that is why he is gained too much weight is only one reason, or he is not doing any physical activity is a second reason, but besides this there are 38 more reasons, right? So all of these need to be understood, so they can meet a dietitian, they can meet a doctor to help them understand कि अगर इतनी मेहनत करने के बाद भी and if they're doing enough physical activity नहीं हो रहा है, तो they need to discover more things.
नाजरीन जी, मैं ऐसे बहुत से लोगों को जानता हूं जो ओबीज हैं और जो हमें बताते हैं कि कंट्रोल डाइट लेते हैं, थायराइड भी नहीं है, वॉक और एक्सरसाइज भी करते हैं, लेकिन ऐसा लगता है कि जैसे हवा से उनको ऑक्सीजन से उनका वजन बढ़ जाता है, पानी और ऑक्सीजन से बढ़ जाता है। ऐसा क्यों होता है? कोई खास बीमारी?
मैं यही बता रही थी किशोर जी कि आज रीजंस बहुत सारे हैं। ओके, इट मे बी अ हार्मोनल इम्बैलेंस, जैसे आजकल हम बहुत सारी यंग गर्ल्स को देख रहे हैं, इनका वेट बढ़ रहा है पर इनका हार्मोनल डिसबैलेंस पूरा हो चुका है, इनके पीरियड्स रेगुलरली नहीं आ रहे, और स्ट्रेस लेवल्स आज ओवरऑल सब में बहुत हाई है। सो ऑल दीज आर आल्सो अदर रीजंस व्हाई इट interferes. So food and exercise are not only the reasons why people gain weight. ये बहुत मतलब normally, and this is हमारे क्लिनिक में भी जब लोग आते हैं तो ये बहुत सारा शेमिंग होता है, जैसे फैमिली बोलती है अरे ये तो कुछ कर ही नहीं रहा है, या either which ways, But we need to understand that this whole process of obesity is beyond food and exercise too. There are many more factors involved.
मेरी तरफ से एक आखिरी सवाल
जी।
नवरात्रा का समय चल रहा है, ज्यादातर लोग खास करके महिलाएं फास्टिंग करती हैं, अनाज नहीं खाती हैं, ऐसे में उनका जोर जो है मीठा खाने पे होता है, उनके लिए क्या डाइट प्लान?
उनके लिए बहुत जरूरी है कि चूज नेचुरल फ्रूट्स, बहुत शक्कर वाली, बहुत आलू वाली, बहुत स्टार्ची चीजों के बजाय यूज नेचुरल कंटेंट. Some of the millets like the varagu, kodo, these are also used in fasting foods. इनमें भी काफी natural nutrients होते हैं कि बाकी का अनाज नहीं खा रहे, पर एटलीस्ट फ्यूलिंग होने के लिए important है. In fact, next year we are celebrating International Year of Millets. So these fasting millets are also very important. बाकी हम fruits का इस्तेमाल कर सकते हैं, nuts का इस्तेमाल कर सकते हैं. तो actually you can use this fasting time very intelligently also as weight loss. और फिर शाम में जाके डांडिया खेलते हैं तो अपने आप एक एक्सरसाइज भी हो जाता है. तो you can intelligently use this entire time to actually lose weight and look much better. And ऐसे भी नवरात्रा है, एक हैप्पी टाइम है, तो स्टेट ऑफ माइंड भी हैप्पी होता है. तो लिटिल बिट ऑफ फास्टिंग एंड कैलोरी रिस्ट्रिक्शन आर द बेस्ट वेज टू एक्चुअली लूज वेट. तो थोड़ा कैलोरी रिस्ट्रिक्शन एक स्टडी किया था 4 सालों में जिसको बोलते हैं लुक अहेड ट्रायल. इसमें बहुत सारे अलग अलग स्ट्रैटेजीज लोगों ने यूज किए थे, पर बेस्ट था कैलोरी रिस्ट्रिक्शन एंड अ बैलेंस्ड डाइट ओवर अ लॉन्ग पीरियड ऑफ टाइम.
थैंक यू नाजरीन जी. ओवर टू यू मिस्टर शंकर.
Thank you, Kishore. Ms. Nazneen, can you unmute? Yeah.
Yes.
Yeah, welcome. So this issue of obesity is something that moves in slow motion. You actually do not know when you become obese. You start putting on weight. It's only when a relative or friend you meet after about say 3 or 4 years they tell you, oh, you put on a lot of weight, and that is when you realize that you have started becoming obese. Right. Now, today's topic actually is obesity, when and how to start a weight loss journey. So can you describe more on that?
So I think, being aware of your weight is extremely important. This is what we tell everyone. Just as we, have a mandate of brushing our teeth every day, probably having a small bathroom scale is an important thing. Because maybe not every day, but at least once a week, you need to weigh yourself. Okay? You also need to record. We have to be a little self-aware of it. So it begins with a process of self-awareness. Today, if you're feeling too tired, too lethargic, physical activity is going out, stress is increasing, post-pregnancy challenges are there, then these are also places where the entire diet has completely changed. We've seen that women post-marriage suddenly have gained a lot of weight. And often when we kind of, interview them, we realize कि पहले जो है मम्मा टिफिन बना के देती थी, अब जो है इन ससुराल में खुद ही टिफिन बनाओ, खुद ही you want to go to work, you want to do everything. In that whole process, your attention on your own diet really reduces. And then your dependency on, fast foods, high calorie foods, ordering from outside, eating out increases. So these are also life incidences which kind of promote these things. Also, as for men, mostly when we do corporate workshops, we understand that as you move up the ladder, travel increases again, lifestyle changes are there, and adhering to a fixed diet becomes a problem. Also, affordability जैसे increase होता है तो हम सोचते हैं कि आज हम अच्छे रेस्टोरेंट में खाएंगे, आज हम खाना ऑर्डर इन करेंगे, Zomato, Swiggy का अच्छा इस्तेमाल करेंगे. So all these changing factors also suddenly, slowly वजन बढ़ता है. जैसे हमको कॉलेज में, the way we were taught in college that even only one single roti at every meal is 100 calories. So if I'm eating one extra roti at breakfast, one extra roti at lunch, and one extra roti at dinner, okay, I have straight away gained 300 calories. I'm not talking about any junk food here. Yeah? So even smaller things, and in India we have this thing of expressing love. So we always say, "Beta, ek roti aur kha le." We don't say "I love you." We say, "Beta, ek roti aur kha le, ek paratha aur kha le." So I think these smaller things we need to be aware of.
Yeah, that's right. Now, there is an interesting study. You mentioned this earlier also. There's an interesting study by a real estate group, which said that earlier, at least people of my age group, we wanted a large kitchen, we wanted an open kitchen, and we wanted shelves, we wanted all those things. But they say strangely that in today's generation, when it comes to bedroom, they want the bedroom to be large, the living room to be large. But when it comes to kitchen, they say make it as small as possible. The kitchen itself is enough, because they say, why say I'll be ordering food from outside most of the days? I don't need a kitchen. So this ordering business from outside is one of the major causes for obesity. Is it right?
Yes, especially urban areas where both the couples are working. I think it is becoming a major challenge, because your incidence of cooking at home, the healthy cooking at home, is slowly reducing. And even though there are some options of eating healthy outside, पर लोगों को ऐसे ही लगता है कि ऑर्डर इन करें तो कुछ टेस्टी ही ऑर्डर करें, so you are not always ordering in health food. So that definitely is a challenge. And time, I think, is the biggest crux ki many people say also कि मैम हमको healthy खाना है पर बनाने का time ही नहीं है, so like I am from Bombay, and they leave home at like 7 o'clock. They're returning home only at around 9:30, 10. They honestly don't have the bandwidth and the energy to go home and cook anymore.
How difficult is it mentally and physically to reduce obesity?
It's a very, very interesting question, Mr. Shankar. So there is a journey for everybody in their mind, okay? And these are also stages. So the first stage is first stage is you're not even thinking that you're obese, or you need to do something about it. The second one is pre-contemplative stage. यहाँ पे हम सोच रहे हैं कि अच्छा मेरा वजन बढ़ रहा है, I need to do something about it. The third stage is contemplation, where you think that okay, I'm really weighing high. When I'm climbing upstairs, I'm feeling difficulty to breathe. Okay, my blood pressure is rising. And when I tested my blood sugar, HbA1c was on borderline high. I am a pre-diabetic. Here you think, okay, I need to go and see a doctor. I need to see a dietitian. Then they finally, and that journey itself from pre-contemplation to contemplation is 6 months to maybe a year. Then after that, they actually finally decide to do something, and that's where they schedule an appointment and they come to us. So even when these patients come to us, we put in too much effort, because we know it has been a long mental journey of jao, nahi jao, will things work for us? We'll go to a dietitian, she'll stop all the good food in life and we'll have to follow a strict diet. So it's a lot of mental barriers a person actually faces before he even starts the journey. Once they've started the journey, it's all new. Some of the things the dietitian has told them that, okay, you need to include this. Whilst most qualified dietitians would try to give them a diet closest to their own lifestyle, but still there are some changes. Adapting to those changes takes around 15 days to a month. Uske baad, okay, now he's starting to lose weight, 2-3 months. He's feeling super good. But then comes the maintenance stage, which is a difficult stage. Now you've lost food, you're feeling good about it, and slowly now you're going out to a gathering and your friend will say, "Kha le yaar, kya hai? Kuch nahi, abhi to itna wazan lose kiya." And that maintenance phase is a tricky phase, because that's where again, you're slowly giving into temptations, going back to old lifestyle, and boom, again comes the weight again springs up. So at every stage of your weight loss, right from starting to following it, there are a lot of mental hurdles. It's a struggle by yourself, and also you say that, okay, tomorrow is Monday morning and I pledge I'm going to go for a walk in the morning, but that doesn't happen. And when that and nobody knows, you've not announced it to the world. It's a promise that I have made to myself. But when I'm not able to fulfill that promise to myself, somewhere there is a hit. It affects my confidence level. And if I promise every day, my confidence level is really low. My self-esteem is now not really so great. So I think those mental barriers are very, very important.
What's your viewpoint on bariatric surgery so far as for obese people?
So today, very, very interesting again. Today, there are very set parameters on where lifestyle works, where lifestyle doesn't work. Okay, so if a person who has a BMI of 30, okay, but he has too many comorbidities, like he's a young person of maybe 40 years or 35 years old, and has a young kid, and weighs around 130, 140 kilos, probably as much as he diets and as much as he exercise itself is very limiting, because pressure comes on the knees, he's not able to walk, he's not able to fit into the gym equipment. So those are some of the challenges. Lifestyle doesn't work there, and he has already so many comorbidities. So in that case, if he chooses bariatric surgery, he actually benefits from it, because it helps not only in reducing weight, improves his self-esteem, but all these comorbidities like diabetes, knee problems, hypertension, all of them also reverse back.
Can you briefly tell me, obese, how careful should obese people be before they hit the gym? It's normally you go there to reduce weight, to shed weight. How careful should they be?
I think it's very important. First, you get a thorough medical checkup done. Okay? Especially, you need to do a eco stress test to see what is your own fitness level. You don't want to be walking on a treadmill in the gym and suddenly collapse there. Okay? So check your own medical status. Then besides that, some of the caution factors there, that many gym instructors are also over enthusiastic. They make the person push. Okay, so you need to find a qualified gym instructor. Weight training helps, but again, here it's very important that we find somebody qualified. Otherwise, you'll be landing into more damage than good. And also choosing many a times with people with very high weight, going to the gym itself is a challenge, because you are seeing all these very, very fit people. You're not feeling too good about yourself. So, you're constantly looking in the mirror, and gyms today are all full of mirrors. And when they look at themselves and they look at this very fit person, there is a lot of mental stress which is going on. Many times they don't even fit into the equipments, which becomes even more embarrassing. So these are some of the practical changes for them. Maybe they should look at some functional training. They should look at some kind of functional training exercise, so that they are able to maintain the whole process.
Thank you very much, Ms. Nasini. I think we just come to the time. But before we go, I just wanted to remind you that you spoke about temptation, and Mark Twain had once said that the best way to fight temptation is to yield to it. So that is the problem with obesity, that you yield to your temptation. Thank you very much. It was a wonderful show. And this show is important because here are two ailments. One is breast cancer, which can easily be detected and avoided. And obesity also, which can be easily combated, provided you are careful about your lifestyle, your food, and other aspects of living. So this marks the end of the 11th episode of IHL show. And we look forward to having you again on the next show of IHL. Thank you very much.
Thank you.
Namaskar.
Thank you. Namaste.